Dr. Hulko, you graduated medical school, correct?
That's right.
And also you completed your postgraduate medical training, correct?
That's correct.
How long did you work as a surgeon before coming to Canada?
I have a 10 years experience in practice of surgery.
Are you currently working as a physician in Canada?
No, unfortunately, no, because I can't.
And then Dr. Hulko, do you agree that there's a disconnect between the immigration system and the healthcare system in Canada?
Unfortunately, I have to agree with this.
Dr. Hulko, according to the College of Physicians and Surgeons of Canada, there are 13,000 internationally trained physicians in Canada who are not working as doctors, and you are one of them. The government keeps saying that we need more immigrants to solve our healthcare problem, but they have failed the immigrant doctors who are already here in Canada, such as yourselves. Do you believe the government should focus on licensing immigrant doctors that are already here in Canada before adding more people to a broken system?
I truly believe so, and I honestly believe that it will benefit Canada a lot. It will solve a lot of problems in healthcare. It will benefit Canadians, first of all. Yeah, for sure, it will be beneficial for everyone. I don't see any reason not to do that. So,
emergency rooms are overcrowded. Millions of Canadians don't have a family physician. And yet, sitting right in front of Parliament, we hear from a fully trained surgeon with a decade of experience who is not allowed to practice medicine in this country. Dr. Antanina Hulko did everything Canada says it wants. She completed medical school. She completed postgraduate training. She practiced surgery for 10 years before coming here. But when asked a simple question, are you working as a physician in Canada? The answer is no, not because of incompetence, not because of misconduct, but because she can't. This is where the conversation shifts from individual stories to systemic failure. According to the College of Physicians and Surgeons of Canada, there are 13,000 internationally trained physicians already in Canada who cannot work as doctors. That number alone should stop the conversation in its tracks. Governments keep repeating the same message. We need more immigration to solve healthcare shortages. But this testimony exposes a deeper contradiction. Canada is importing need while wasting capacity. Dr. Hulko confirms what many healthcare experts have said for years. The immigration system and the healthcare licensing system do not talk to each other. One brings people in, the other locks the door. When asked whether Canada should focus on licensing doctors who are already here before adding more people to a broken system, her answer is unambiguous. It will benefit Canadians first. It will reduce wait times. It will strengthen hospitals. And it would cost far less than training new doctors from scratch. This is not a debate about lowering standards. It's a question of alignment. If Canada can acknowledge a shortage while simultaneously sidelining thousands of trained physicians, then the problem is not supply. The problem is design.
We heard from Dr. Scott Alexander, who is Canadian and a doctor, but cannot be a doctor in Canada. He trained at the University of Queensland and even had a job offer from the Australian healthcare system. Still, he could not get residency in Canada, even though he spent hundreds of thousands of dollars on his education. He made the sacrifice to return to Canada anyway to work in health sciences, and we thank him for this. But he should be a doctor in this country. In his medical class in Australia, he had 60 Canadian colleagues. 58 of those colleagues are now working as doctors in Australia rather than in Canada because of the barriers in this country that limit their ability to return home and practice. This is a broken system that the Liberals have overseen for a decade now without reform.
It's a story that sounds impossible until you realize how common it is. A Canadian trains as a doctor at the University of Queensland. He receives a job offer from Australia's healthcare system. Australia is ready to put him to work. Canada is not. Despite spending hundreds of thousands of dollars on his education, despite completing the training required to practice medicine, he cannot secure a residency position back home. So what happens next? He makes a personal sacrifice and returns anyway, not to practice medicine, but to work in health sciences, a role far below his training, a system that thanks him but does not use him. Then comes the most revealing detail. In his medical class in Australia, there were 60 Canadians. 58 of them are now practicing doctors in Australia. Not because they don't want to come home, but because Canada makes it nearly impossible for them to return and practice. This is not a talent drain, it's a policy failure. Canada helps educate doctors, subsidizes parts of their training, and then erects barriers so rigid that other countries benefit instead. Rural hospitals in Australia are staffed. Canadian emergency rooms remain overwhelmed. For more than a decade, governments have acknowledged that doctor shortage while maintaining residency and licensing system that functions like a bottleneck by design. The result is predictable. Doctors go where they can work. Patients wait where systems refuse to adapt. This isn't about ideology, it's about incentives. And right now, Canada's system incentivizes doctors to leave and stay gone.
Dr. Alexander, so you were given false expectations about your ability to practice in Canada after you arrived here, and I'm sure you're not the only one who has practiced, a Canadian who has practiced abroad who's given also those false expectations.
Yeah, to a certain extent, after the 2 years of applying for residency with no success, it did feel like the rug was kind of pulled out from under me because now new requirements were required for me to even have the privilege of applying for a residency in Canada.
Was there an offer you received to stay and work in Australia in their healthcare system?
Absolutely. And I had to make a personal choice. I had an internship lined up in a rural hospital in Australia, and I made the active commitment to come home so that my wife and I could have our family closer to our family. And that was the sole decision why we came home.
That's amazing. Thank you for doing that.
One of the least discussed parts of Canada's healthcare crisis is not what happens after doctors arrive, but what they are told before they come. Dr. Scott Alexander describes it plainly. He applied for residency for 2 years. He followed the rules. Then the rules changed. New requirements were introduced, not to improve patient safety, but simply to preserve access to the application process itself. At that point, he says it felt like the rug had been pulled out from under him. This matters because decisions about migration are not abstract. They're family decisions. Dr. Alexander had an internship lined up in a rural Australian hospital, exactly the kind of placement Canada says it desperately needs. He could have stayed. He was wanted. Instead, he made a choice, rooted in family and community. He came home so his children could grow up near their relatives. That choice came with a cost. Canada gained a resident, but lost a practicing physician. These stories reveal a quieter failure. One of expectation management and honesty. Doctors are encouraged to believe there's a pathway home. Only later do they discover the pathway is narrow. It shifts or disappears entirely. When systems are opaque, people pay the price financially, professionally, and emotionally. And when those people are doctors, the consequences ripple outward. Every delayed residency match becomes a delayed surgery. Every sidelined physician becomes a longer wait list. This crisis is not caused by a lack of talent. It's caused by a lack of coherence. Until Canada aligns its promises with its policies, the system will continue to lose doctors. Not because they don't care, but because the system doesn't let them serve.